Good morning, everybody, and it's a beautiful Tuesday, both in Miami and in Northern Virginia and Washington, D.C. And we have with us a dear friend of mine, Dr. Rani Gereige. Rani is a board-certified pediatrician and director of medical education and designated institutional official at Nicholas Children's Hospital in Miami, Florida, a position he has held since February 2010. Rani earned his medical degree from the American University of Beirut Faculty of Medicine and is now a clinical professor at the medical school and has contributed to over 44 publications in the field of medical education. In addition to his roles in medical education, he serves as diversity, equity, and inclusion lead at Nicholas Children's Hospital, and he advocates for child health and is a proponent of evidence based medicine. He's a dear friend of George and I, and he's a frequent guest on the podcast, and he holds a CME that is celebrating 60 years and one that I really delight in supporting and attending it almost every year when I can. Rani, my dear friend, welcome back.
Thank you for having me back. Great to see you. Um,
Thank you. How have you been down in sunny Miami?
well, it's been great. It's our cold front, I guess. Little cold for us, but I'm not gonna say how cold it is for us because I'm sure this is will be your summer. I know.
Yeah, this year you're celebrating 60 years of
Yes,
the wonderful CME, right?
yes, we're really excited about it. Our 60th anniversary of the course, so it's gonna be a big year for us for sure.
And what surprises do you have for this coming course?
So a couple of things we're doing. It's a double celebration for us because it is the 60th annual for the course, but also 2025 is the 75th anniversary of the hospital. So the hospital is celebrating also a milestone birthday. So in order to highlight obviously I am in medical education, so to highlight the educational mission of our hospital and our department, we have graduated over the years. So our pediatric residency program has been in existence since 1962. So we've graduated tons of uh, former residence fellows, people who kind of now are in leadership positions in their specialties and subspecialties. So we're trying to, one thing we're doing is we're bringing back all of our speakers this year are going to be former alumni of either the residency program or the fellowships. And we're bringing, some of them are local and some of them are more actually guest speaker than local speakers in different specialties. So we can bring back people, let them kind of see the hospital, all see the way things progress, but also see friends and reconnect. And it will be good to see them as well for us. Some of them I know since 2010, but some of them predate me. So it would be nice to kind of, bring people from all the way. I think the earlier class, we have one speaker from 2002, I believe. So that's 20 something years.
Wow. So this course has been going on for 60 years, right?
Correct.
Who started it? Do you know?
Yes, it was started by Dr. Donald Altman. And I think the course itself, the title of the course, even though it's pediatric postgraduate course, there's a small tag that still refers to Donald Altman as, the founder of the course. Dr. Donald Altman was a pediatric radiologist. He was the head of the radiology department at that time, actually one of the speakers who's coming to speak to do the lectureship. She remembers him. He passed away, unfortunately, but his son, Dr. Nolan Altman, is actually now the department chair for pediatric radiology. And Dr. Donald Altman had, I was told he was a big proponent of education. He had started our radiology conference that happens every Wednesday and still happens to this day. Kind of his son took on doing it as well at the hospital. And he started the course more aimed at general pediatricians as the audience rather than, even though he was a subspecialist, but he was more really interested in actually having a course that's the CME course for primary care pediatricians with different specialties featured, but primarily the target audience are primarily generalists. Um,
Wow. And so Dr. Altman is really now the grandfather of pediatric radiology, right? When he moved down to Miami, which what used to be called Miami's Children's, there really was not a pediatric radiology specialty. And if I'm not mistaken, he has been a big part of writing, or was a big part of writing the textbooks on pediatric radiology too.
Correct. He was one of the leaders in pediatric radiology back then. Pediatric radiology was not, a subspecialty by itself. It was more really you kind of do a general diagnostic radiology and you work in a pediatric center. And he was really actually, he was the first radiology resident at Jackson Memorial where he trained, but he basically passed away back in 2014.
Well, and the CME course has been phenomenal. I mean, I'm not old enough to have attended the first one, but I met some great people. Amongst them that I'll never forget is Ralph Feigen, who is co-author of Feigen and Cherry. He's passed away too. Textbook of Pediatric Infectious Diseases, which is the Bible of pediatric infectious diseases. And he used to lecture every year. When I started going, as you might recall, it was held at the Sheraton at Bal Harbor. Now that's at St. Regis. And it was a little bit longer course. It was almost a week long course. And they had subsections. So if you're interested in ID, they had an afternoon that concentrated in lectures in ID. If you're interested in sports medicine, they had a subsection of lectures for sports medicine. And I met one of the pediatricians, forgetting his name. He's a young guy, or he was a young guy when I met him. That was at the Hospital for Special Surgery in New York. He publishes a lot in pediatric sports medicine. And
Mhm.
it was you met really some of the authors of these huge textbooks of pediatrics at the meeting. And the Sheraton had a very nice lazy river that you could hang out afterwards in an inner tube. And it was right on the beach, so
Very memorable.
it was very memorable. It was a great experience. Then through the years, because of how we are learning now and COVID and so forth, it's become more condensed to just a weekend event. The quality of the speakers is incredible, and the people at Nicholas are so nice, and the venues are so wonderful. Not only do you learn, but you just have a really great time. So Dr. Altman's son will be speaking, right? And then I think I was looking at some of the topics and very interesting topics. One is on vaccine hesitancy, which is becoming more and more of a problem in the exam room. That'll be very interesting. You leave the ID topics usually for Sundays. That's always been the routine. And what other topic do you think will be very interesting other than the vaccine?
What we did this year is we always listen to our audience and get the feedback. And I think also nationally in the CME world, it's been shown that now new generation of learners are more interested in shorter sessions rather than the old way of doing the full hour and you're listening to one speaker for 1 hour. It's actually going more to a shorter, more really telling the essentials about the topic and then have more variety of speakers and topics that will allow you to actually mix and match. So that's what we went to this year. We went to probably it's a more challenging for a speaker to cover a topic in 30 minutes. Um, but also we are instructing our speakers to be more practical. If you're talking about, I don't know, obesity, for example, everybody knows it's a problem. There's no need to spend 20 minutes on the problem and then zoom through the important stuff that pediatricians want to know. Tell me what to do. Tell me when, how to treat. Tell me. So that's what we're trying to actually more focus on the practicality of it. Now we divided the sessions into not really tracks, but into kind of bunched up areas. So we have obviously pediatrics. We want to feature some hot topics coming off, new things that are coming off, like for example, screening for diabetes. You're very familiar with that.
Oh, wonderful. You're going to have that
Um,
on the CME?
Yes, absolutely. We have also new, immune modulators for cancer treatment. So again, those are like more like hot topics, emerging stuff. some of the emerging infections. There are new viruses coming out that we're seeing. So those are the hot topics. There are going to be a bunch of lectures that are aimed primarily at the health supervision or maintenance. So it's more like screening. That's usually some of the mental health topics, some of the common things related to the health maintenance visit, including one vaccine talk, and that's where the vaccine hesitancy will come up because that's something that pediatricians face in every well visit pretty much most of the time.
Yeah. Yeah.
And then there's a third bunch that is more really common core pediatric stuff. So it might be more a quick review, quick update, something as basic as UTI management, as murmurs, as what's new in certain things like oral health. So we do have, again, since we also have a pediatric dentistry residency program, so we're using some of our alumni from our pediatric dentistry program to actually be featured as well. Things like screening, like for STIs in teens. So those are common topics that will be more on the health maintenance visit. Seizures, they're going to be one talk on differentiating between nocturnal seizures and night terrors. And then one talk about preparing the office for poisonings and emergencies. So basically allowing kind of pediatricians to know a little bit more, especially those pediatricians who are practicing in a rural area where maybe EMS is not quick to come to them. So, and maybe, I mean, obviously, maybe a lot of states have poison control centers you can call and get some information. But if you don't have the stuff available in the office to help, whether it is what you need to do to intervene or stabilize until the EMS comes to your office. So hopefully that will be helpful to some pediatricians. And then we do have one talk on pediatric survivorship, which is really fits into the pediatrician health maintenance visit for survivors of cancer and kind of looking at kids because now kids fortunately are surviving longer and getting to adulthood. But there are certain things that maybe pediatricians need to know. Most of the times, if you're close to a tertiary care center, sometimes the hematology oncology specialist becomes the pediatrician or the primary care. But maybe in some societies or in some communities, the pediatrician had to take more an active role. And then we have only one session. It's kind of interesting. Only one session on social media that is not going to be by an alumni. It is going to be by, we do have through our psychology department. So the person who's going to moderate the session is actually an alumni of our psychology program, but the speakers are teenagers. So we do have
Oh, wow.
a focus group that we hold at the hospital for related to safe social media and safety in social media in general. And we do have teams who basically act as peer support groups for peers. And the teens are going to be actually primarily talking about doing the
Y
session.
Oh, how cool. Now, I'm gonna diverge off topic for a second. What is the Brian Seacrest Studios now at Nicholas Children's Hospital?
Yeah, that's great. It's going to be, so Brian Seacrest has different studios in different hospitals where actually it's almost like a radio studio where it will be broadcast to the rooms and patients who are able to leave the room and actually go down and will be actually doing a lot of obviously there are people who are always running it full time, but there will be programs kind of geared for kids around the kids who are in the hospital who are able to kind of leave the rooms. And then Child Life will also be doing some stuff at the same time. We did used to have a while back when I first started at the hospital, a very similar concept called Radio Lollipop here at the hospital, where it was like a radio studio that will be broadcast to the rooms and they do kind of songs and interviews and it kind of like basically it was an older version and it kind of went away for a little bit because of space. So now this is being brought back and it's actually supported by, it's a Ryan Seacrest Foundation that he has multiple of those radios studios in different children's hospitals.
And so are you gonna use that for your pediatricians and CME too, or is that not a use that's allowed?
We haven't explored that. I think currently it is probably more education for the families and the kids. So there could be more really doing programs on, maybe social media, maybe on, healthy eating, maybe on, so it's almost like really almost anticipatory guidance that's going on the airwaves and going to
Yeah.
in rooms. So will be cool, and it could be customizable. So maybe, there will be features of certain things related to, diabetic diets or kids with inflammatory bowel disease and what they need to kind of know more about the disease from their standpoint at their level. Or maybe, somebody newly diagnosed with celiac disease and what kind of, how can they actually read labels when they go to shopping and look
Oh,
at
cool.
certain things. So to
That'll be
empower
very, very
patients and families.
that's very cool. And then tell me about the venue. This year, although it's a Miami crew, we're gonna be up in Fort Lauderdale?
Yes, actually, we're, as Nicholas Children's Hospital, we do have obviously a catchment area that we have urgent cares and specialty care all the way to West Palm Beach. So sometimes we do have some of our uh, physicians or our pediatricians who basically feel part of the hospital. So we wanted to kind of be a little bit more centrally located. A few years back, if you recall, we did in Hollywood, Florida at the Diplomat. So this one, we are going to be at the Marriott Marina. I'm sorry, at the Hilton Marina in Fort Lauderdale. It's a wonderful venue. It is not too large, so it will be the only group in the hotel as far as large groups. So we won't be competing with other groups. It is, while it's not on the beach, but it's on the Intercoastal Causeway, and it is actually the hotel itself is a station or a place where you can take the water taxi that goes to both Las Olas and the beach. It is actually going to be a wonderful venue because has beautiful pool area, very resort feel to it, but also easy access to the beaches, to Las Olas, to kind of explore a little bit more of the warm Florida during in March. So
Nice.
excited about it.
Very nice. This is gonna be very exciting. And who should attend this course?
So even though, when Dr. Altman had created the course, it was geared toward primary care, and that's where we try to keep it. But at the same time, nowadays, primary care physicians do different things. Some of them are actually doing primary care in an outpatient setting. Some of them are doing urgent care. Some of them are doing inpatient and well baby nursery. And so we try to have multiple sessions that are actually geared toward, everybody could benefit from, including the afternoon workshops where we didn't speak too much about them, but usually there's two concurrent sessions that people could choose from, and we have the surgical specialties bunched up together, maybe doing cases, and then so maybe somebody's working in urgent care, but maybe they might be interested more in that. So we hope that all pediatricians could join us from different even subspecialties, but we know that a lot of pediatrician subspecialists have their own subspecialty society meetings. So really, our big audience will be general pediatricians, primary care physicians who are working in outpatient setting, hospitalists, urgent care physicians, allied health professionals who support those physicians in their offices or in the hospital or in ER or urgent care. So all of those actually would find definitely a lot of valuable information. We do also, obviously, we provide the CME credits, but also we provide MOC Part 2 credit for the course. It's going to be around 16 credit hours as well. And, we're hoping to definitely people will get engaged, and hopefully we're going to have an opening reception and some celebrations for the 75th anniversary and the 60th anniversary of the course and the 75th of the hospital. And we're hoping to actually see some old friends and make new friends.
And we left out the family practitioners,
The family, absolutely.
they also do a lot of
Mhm.
pediatric care, especially in the rural communities and, you know,
Mhm. Family medicine.
med pace, yeah. I don't know how the family practitioners do it. I can't
I
keep all that in my
know.
head. But they
Absolutely.
do it and they love it. And
Absolutely.
then let's reminisce a little bit about Nicholas Children's Hospital. From little I know, Nicholas Children's Hospital was a polio ward back in the 50s. That's where it started. and had
Well,
a different name, correct?
correct. It was, it's interesting. The name was, it was a hospital. They called it Hospital for Crippled Children, but it was actually a polio ward with iron lungs. And it used to be called Variety Children's Hospital when it first started, because the Variety Club was actually a almost like a circus show that actually did a lot of fundraising in the beginning to create the hospital. So it was called initially Variety Children's Hospital, and then the name changed to Miami Children's Hospital when it started becoming less of a polio hospital and more of a general
There's
medical hospital the way we kind of know it now. Before.
is there lots of pictures of the polio wards
Yeah,
archived?
yes, absolutely. We do have a lot of black and white pictures from the polio ward. We're gonna have a lot of in the exhibit hall and in the course. We're gonna have an area celebrating the 75th anniversary. I believe the hospital is working on an exhibit, one of the History Miami Museum. So we're if this gonna be open during when the course is, and I will know more shortly. We will figure out a way to maybe get we intentionally kept Saturday an early day where the course finishes a little early. If we have to maybe bring people either to the hospital to do a tour or to bring people because I'm sure alumni would love to see the campus again, especially those who graduated back in the days. And, or if there is a museum nowadays, there's way easy ways to get to from Fort Lauderdale to Miami using either the Bright Line or so we're figuring out the
Oh,
extracurricular activities.
oh, wow, wow. And, yeah, 'cause it'd be great. I don't know if there is one, but it'd be great to see an iron lung. I've never seen one except in pictures, and it seems like such a scary machine. I can't imagine being a child stuck in that for months. I don't even know how they prevented them from getting bed sores.
Yeah.
I have no idea if it rotated or how they did it, but it's such a tragic thing that can be prevented by a vaccination. And then, Miami Children's, which is what I knew it as, and I still sometimes call it like that, changed over to Nicholas Children's by really, really generous philanthropic donations from the Nicholas family, correct?
Correct. Jack and Broba Nicholas. And that was, I want to say maybe 2015 or so. And since then it's been Nicholas Children's Hospital. In September, actually, we opened our surgical tower, which is the Kenneth Griffin Surgical Tower. And we went from eight operating rooms to 12 operating rooms, large, twice the size of the old operating rooms with state of the art equipment. Basically, the operating rooms get actually sterilized with the UV lights and
Oh, wow.
the whole like it looks like a club because it's kind of like that kind of a blue light. But
So
it's
can we go dancing there?
so it's a beautiful space, and really the hospital as surgery. It's a referral place for a lot of surgical specialties, from neurosurgery to general surgery, urology, and orthopedics is a huge need here in Florida, and that's a great service to the community to be able to decrease the wait time for the families by having more operating rooms, but also having the state of the art equipment that we were able to have by having a brand new tower rather than upgrading the old operating rooms.
Wow. And so Nicholas Children's has become an international hospital, both from the physicians in training and even the medical schools, right? I think you have some sort of agreement with one of the islands. And patients not only come from all over the enlarged Miami metro area, but they also come from other places in the country to see people like um, Dr. Carrillo, who is a world known pediatric diabetologist, and they also come from Latin America for specialty care, both as should I say, mercy cases where they don't have the access in their home country and they're not paying, and Nicholas gives the care for free, but also people that want a consultation with a super specialist and can afford to get that consultation and then go back to their home country for ongoing care. Um,
Right.
so it's a phenomenal hub that very much mirrors Miami, a multicultural um, experience. Um, you have, I think, almost 300 beds now at the hospital.
Yes, 309 beds at the hospital now. And you're absolutely right about this, serving not just South Florida, but also the whole United States and beyond. We do have patients that come from not just South and Central America, but as well as the Middle East, Spain, Europe. The foundation does have funds for based on needs for offsetting the costs for free care for patients for especially specialized care that maybe then it's not available in the country. But also, and as you said, our trainees, our training programs, residence fellows, we attract from obviously Miami being so diverse, we attract the diversity that reflects the community, both in our trainees, our employees, our nurses and staff and allied health professionals. There's a lot of diversity in Miami in general and in Nicholas Children's to kind of reflect the community as well. And also our global health division has a established an office of global health now in a couple of the Central and South American countries. So there's one in Medellin with affiliation with the Hospital Infantil at CES University. There is one that's being open in Ecuador. And again, this is also to kind of show the power of some of our alumni is a lot is really with places where maybe there were alumni of the programs, the residency program, who went back to their countries and became kind of Nicholas Children's ambassadors. A lot of them come back during the course for the PPGC course to kind of from Peru and Ecuador. And I know you've met few of them. Uh,
Yes.
a lot of them also help us establish because they know the needs more than what we know, and they are actually active in the community and in the pediatric societies. Um,
Well, if you ever have the need for someone, a podcaster with a pediatrician to travel to Medellin or Costa Rica to help Nicholas Children's global effort, I know a guy that's dying to go with you.
there you go.
I think that's wonderful. And this is a tinge bit political. Having been born in Colombia and lived in several countries in Latin America, in Europe, and the Caribbean, it is sometimes a little bit off putting when NGOs or organizations that don't truly understand the needs of, you know, people try to dictate from the top to our countries how pediatricians should work or how we should take care of our own kids. One that I know gets me in trouble every time, but you cannot tell a Spanish speaking mom that she's not supposed to go sleep with her infant. I know it's not safe, but you tell them that, they'll take the purse and land it in your face because that's what they do, you know? And in some areas of Latin America, which I think is reflective of the whole world, people have a one bedroom house and everybody sleeps in the same bedroom.
So,
And that's just the reality. And unfortunately, they cook by burning firewood and they go to the bathroom in an outhouse.
mm,
And so I think it's so offensive to try to take the lessons that we have learned in the US and try to mandate those for peoples whose reality is so far from that. They don't, when I'm at your course, one time I was shocked. I lived in Dominican Republic and I was talking to some Dominican Republic pediatricians and they don't follow the full DPT and polio schedule simply because the government doesn't have enough money to do 4 shots.
mm,
Right? So are we gonna talk about co-sleeping in the Dominican Republic or trying to help them get enough polio vaccines and DPT vaccines and hip vaccines so that they don't see these infectious diseases that we have conquered through vaccinations? And unless you've lived there, you've seen the poverty, you've taken care of patients there, I think you're being a little offensive when you're trying to tell them how to do it. So I just love this idea of partnering with people who are actually doing the work, understand the culture, and provide them the resources that they ask for, not what you tell them to do. Wonderful. I love that. But in all seriously, if you ever need someone to go there, I would be so happy to go. Then you have, I forget now, is it 30 residents?
No, we have 84. So 28 per
84,
year. 28 per year.
28 per year. Okay, so it's 28 per year. Okay. And then two are chief residents, right? You get two chief
So
residents.
86 total. Yeah.
Yeah. And then you have fellowships now?
We do have 17 fellowships. We have 17 fellowships, around 44 fellows in spread
Okay.
into 17 fellowships. Our newest programs that we opened last year that we're now recruiting for are pediatric orthopedic surgery fellowship and child neurology residency. There's a lot of need for child neurologists in the country.
Yeah.
And now we're working on pediatric endocrinology to open
Wow.
it next year. We do have obviously in the 17 fellowships around maybe 8 or 9 are in pediatric subspecialty. So right under peds, so you finish a residency in peds, and so under the American Board of Pediatrics. And then the other half probably are surgical subspecialties, radiology,
Wow.
surgery or urology, plastic surgery, craniofacial, and then ortho is a newer one. Uh,
Huge, I bet. Yeah. Yeah.
so
And you know, we read a lot about how the match is a failure year after year in pediatrics, and this year was really terrible in pediatrics of specialists. But I think your experience is different. You really match with high quality candidates every year.
yeah, I mean, we've been really lucky, but it is really as you naturally has been a challenge because some subspecialties actually gained a lot of applicants and not enough programs. So like allergy immunology, there were a lot of unmatched applicants. And then there are some subspecialty this year, like hemonc, PICU, that actually had many unfilled spots, which is also not the greatest as well, because if you're talking about workforce in the future, needing more, especially that are already, we know some subspecialties are underserved, like nephrology, rheumatology, there's home. So luckily, yes, we've been lucky, although, I guess Miami being diverse, Miami being also, we are a very, our fellows and residents are mixed as far as international graduates and American medical graduates. And we welcome everyone based on their merit and their academics rather than, where they graduated from. So, and Miami is obviously a desirable place. And because it is so diverse, people see themselves, fitting in more. And that's maybe why, obviously the weather helps as well.
Oh,
Um,
I'm sure. I'm sure. But I think also there's a culture of kindness and inclusiveness at Nicholas, which is it permeates. It's it's from you're at the CME event and everybody greets you,
yeah.
from the support staff to the people running the course. And you see that kindness, openness, commitment to serving not only Miami, but the country and the global community in a kind and informed way. And so I think that's I don't know who created that culture. Was it Dr. Altman or who somebody created that culture, but it's palpable. And I think that really helps you. It's an excellent center, but the culture exudes kindness and inclusiveness. And that is not so much in many highbrow academic centers. So
Thank you.
it's
We're happy to hear that because this is something we strive to achieve. I think it's important for our trainees to have role models who are modeling the same. But also, it's like a one. I tell applicants when I interview applicants, this is like one big happy family, and a lot of people know, a lot of our faculty are actually former alumni of the program. They probably left, went for fellowship somewhere, and then they want to come back. It's a place. Even when I interviewed for my position, I think what struck me is how low turnover the place is. Like when you ask people, I've been here 25 years, I've been here for 30 years. A lot of people have been there forever. I mean, Dr. Allman was the chief of radiology for 50 years. I mean, to stay
uh,
in one place for 50 years nowadays, like unheard of. And also people who leave because they have to leave, they cannot wait to come back, because they went to train somewhere, and now as soon as there is an opening, they want to come back. So I think that for me, when I interviewed for my position, actually, that was a huge good sign to say this is a place that people not only love to work at, but also if they had to leave, they couldn't wait to come back rather than I can't wait to leave and never look back. So you're absolutely right about your observation. Right on.
Yeah, it's just palpable. You don't nobody has to tell you, there's no slogans, you just feel it when you walk in the door. And those are the best kinds of organizations. Now, so you have a lot of residents, a lot of fellowships, you do pretty much every pediatric subspecialty, and you're gonna celebrate 75 years. I think that's phenomenal, phenomenal. And I wanted to ask you a question about a different hat that you wear. You're still at the CME committee at the AAP, right?
Yes, correct. I'm the chair of the committee until June.
Until June. Oh, this is gonna end soon, and you do the same thing for the chapter at in Florida. And you said something that's very interesting a little earlier on, that what your data that you gather at Nicholas is that people want to be educated in different ways, and they want short 20 minutes. They don't want the old style week-long meeting, hour lectures. In some ways, Dr. Tom Mayer, who's a pediatric surgeon and wrote a book, he says, you need to suck down, not suck up, meaning you need to listen to the people and not just allow like the CDC or the NIH or AAP or Nicholas Children's dictate to the people. And how do you see that changing the way that we educate pediatricians across the country from the hat of the AAP, which is, somewhat involved in education and continuing education of pediatricians at the national level?
Yeah, that's a great question, and this has been shown a lot when we look even through my role in the AAP CME. When we looked at we track attendance of different sessions at the NCE, and if there is an hour and a half lecture, which sometimes there are, usually these are the interactive ones that are almost like a workshop. They're not really all lecture. They could have probably some breakouts within it. We try to get, those are the ones that are allocated for that. And usually the proposals get accepted more if they were showing interactivity so even though it could be an hour and a half, but almost every 20 minutes, the speakers or the proposing parties for the session that are actually changing tone, okay, we're going to do 20 minutes of lecture, then we're going to break into groups, then we're going to work on something, then we're going to come back and then report. So the whole thing. And then you see it also in NCE as well. The plenary sessions are only 20 minutes each, but there's so much you could get gathered from those plenary sessions because it's a high level, it's a big picture, and also kind of like the whole everybody's attend those, and it's very popular to attend them. Some of the ones that are an hour or actually were changed to become more like 45 minutes in NCE. So we used to, those were like a brief sessions, a small short sessions. So I think more and more people are looking to kind of either have interactive learning, if it's going to be longer than 20 to 30 minutes, to have some type of interactivity built into the session, or multiple speakers that kind of change the way you teach. So you might, even though you might be doing a lecture for a little bit, then you might go over cases or do audience response and polling. So actually the audience is not sitting just listening to a talking head for the whole hour or hour and a half. I think we're seeing it even in our learner, even though we're still our grand rounds at 1 hour, our noon lectures co-curriculum for the residents are 1 hour. But I think people sometimes, there is data that show that you probably get more the first 20 minutes, you're going to absorb the most of it. And then unless you end the session with like the last 20 or 15 minutes with something really impactful, people might not remember because they're tuned out. As they get tired, and they probably will tune out. So you have to vary the education style. halfway through and make sure that people are actually re-engaged, because otherwise, and I think, we see it a lot also with when we talk to the section on early career physicians, which we have a liaison in, and we're going to have a liaison, a resident, but a trainee, but we currently have a liaison in our CME committee from the early career physicians. And they prefer, a lot of them are used to, listening to podcasts, listening to audiobooks, driving while listening to something, maybe they have a long commute and they drive and they listen to. So they're actually more for the shorter, more snippets that are actually helpful and also more practical, so.
Yeah. Yeah. I struggle with the practicality, like, type 1 diabetes, because the whole concept of type 1 diabetes has changed so much that if you don't understand the immunology, the pathophysiology, it's
Yeah.
hard to make the paradigm shift of this is sweet sugar disease that needs insulin. The kid will manifest when they need it, to this is an ongoing pancreatic inflammation that sometimes can last. There's some people in their 70s that are being diagnosed that
Mhm.
sometimes can last for decades
Yeah.
without you having any symptoms. And, so I think sometimes you do have to explain the pathophysiology and not just the practicality of here, just screen everybody at 2 and 4 years of age with these four blood tests, because then you'll know who's at risk. Move on. Right. But I
So
do think you have to be, I think what I've learned is from, like, for example, oh, I'm going to blank out on his name right now, Anthony Orsini,
Mhm.
the importance of telling the story. The why are you doing it and what is the impact? So, why am I screening for type 1 diabetes? And what is the impact of my screening on moms and children?
Mhm.
And I think that's people want that story, the storytelling more than the cold facts anymore, which is totally different from when I trained. There was no, the only time that they brought a patient into the lecture hall was as an example of the disease, and it was very impactful. I still remember the neurologist bringing in a patient with Parkinson's and putting him on the stage and asking him to walk in front of everybody, and we saw the shuffle and the counting of the coins, all of it, and you never forget it. But so anyhow, I was going to ask you one more question here. What do you think our specialty will look like after we're gone in 25, 30 years?
Well, I mean, I think it's a hard question to guess, but I would say pediatricians are always going to be, are always going to be there. Now, the way we practice might change. I think there is a lot of opportunities when we look at them if it's done correctly with artificial intelligence, with certain things that will make it's already starting as far as making the jobs of pediatricians more satisfying, in a sense that, a lot of the data before on burnout had, blamed a lot the EMR and the documentation. And we see it when people, like I used to do a lot of medical missions, and when you go to medical missions where you really, you don't document a whole lot and you just basically see patients and help patients. And this is your why you went into pediatrics for, and then you feel joy. You feel that joy in, and how can we maybe make use of the active, knowing that we need, obviously, in their United States system, we need the documentation for billing purposes for other things. And it's important to have maybe that documentation for patient safety, because if the patient went from a provider to another provider, at least that stuff is in the EMR. But how can we leverage the technology to actually help us remove some of the undesirable part of the pediatrician's day that's bogged down with things, and allow the pediatrician to actually do what they were trained to do, what they went to med school for. And I'm hoping that maybe looking forward is kind of what's still a pilot in some clinic, piloting AI, piloting documentation, piloting. How can it become part of the not just the practice itself, but even the training early in residency and fellowships and even medical school to actually use the technology more in a safer way. Because obviously there's a lot of, it's new and it's always, there's a lot of risk as well. It's like garbage in, garbage out, depending on what the AI is looking at. But how can we actually train the AI to be able to safely use it without, and it becomes maybe the role of the pediatrician becomes almost like, I mean, in addition to providing the care, the administrative role becomes more really like double checking rather than actually generating the note and
Yeah.
everything.
So George and I use an artificial intelligence scribe, Freed AI, and it does change. I mean, it does change your life. It does change your life. But, it's early on, so it still hallucinates because it's trying to predict what 1,000 pediatricians would do if a child was constipated. And it might not actually be what I want to do. But, this is great. It's much better than typing away and being frustrated because you took 10 minutes to type what you told the parent when you already told the parent. And to your point about education, I think that if you can create podcasts for education for the parents and get, all of that horrible bright futures that there's just no way that you can touch all those points that Bright Future says at each preventive health encounter. If you can get that on a podcast form so that you can give it to the parents in multiple languages,
Right.
and then, they can listen to it before they come into the exam room. And then you can have a conversation and you can address the needs they have. I think that will all be for the better. But without more payment for the services that were provided, I'm pessimistic that the burnout would end because that's part of the struggle. We don't have the resources to do what we know that needs to be done. And that's very frustrating to see a patient in need, like you said, peds neurology, peds endocrinology, peds ID, peds nephrology. You know, I can do a lot, but, I'm not going to manage a type 1 diabetic that needs insulin. I'm just not because that's what the pediatric endocrinologist does. And that's a real problem, I think, for our specialty.
Yeah, and to your point about the little podcast or some type of education for the families that may be based on Bright Future or something like that. I mean, our patients' parents, the young ones are actually almost the same generation of our trainees and our
Yes.
students who are telling us also, I probably would learn more with something short, interactive, rather than, I mean, again, we feel better about giving the handouts to the family just because we've done our job, but we don't know if they're, if the trash can outside your office is actually filled with those handouts.
Yes.
And so again, I think that's it's interesting, question that you posed about what is going to look like. How are we going to? I feel like also they're going to be still the human factor. I think that's not going to go away. I think, which is great because I think people go into the field of pediatrics, or family medicine, because they want to talk to the families. They want to actually see these kids grow and follow them throughout till college or something like that. And I think that hopefully, I'm sure that this won't go away. It's more really maybe give them more face time with the families if they are able to rely on something else to help with the non-face time or your
Yeah.
computer.
That'd be wonderful. That'd be wonderful. Well, thank you so much for your time. Thank you for I mean, I just admire the work that you do at the state level, at Nicholas, at the national level with the AAP, and on your
So,
mission work that you do. You're just one of the nicest, smartest pediatricians I know, and I so look forward
yeah,
to every time that we get to be together in the same room. So
thank you so much. You're so kind. Thank you so much.
keep up the great work and all of the blessings for this year that God's thought for you. May they come to be true. And looking forward to seeing you again soon.
All right. Hope we see you in March.
Hope so too.